Federal Medicare laws include 7 principles. The first is a distribution of the written standards of conduct, policies, and procedures. In daily work with Medicare and Medicaid patients, strive to be educated in regards to specific areas of potential fraud, such as the claims development and submission, code gaming, and financial relationships with other healthcare providers. The second is designation of the compliance officer, compliance committee, and other people, consultants, and groups who are responsible for the different aspects of the Medicare and Medicaid compliance program. 3 is the development and the implementation of a regular education and training program for all employees. 4th, the maintenance of the communication process to receive complaints and the explanation of procedures to protect the complaints and protect whistleblowers from retaliation. And unfortunately, that's a problem. Responses to allegations of improper and illegal activities and the enforcement of disciplinary actions against employees who do violate policies, statutes, regulations, or federal healthcare requirements. The use of audits in the practice or evaluation techniques to monitor compliance and assist in the reduction of identified problem areas. And lastly, number 7, the investigation and remediation of identified systematic problems in the development of policies addressing the non-employment or retention of sanctioned individuals. Now, there are specific risk areas to be aware of when maintaining compliance with Medicare. I'm going to go through just a couple. The first is and I'll go through 5 and give you quite a bit of detail on this, and then we'll move into human resources. So the first, as you can see, billing for items or services not actually rendered. Yeah, can you believe that's a problem? No employee should ever bill for an item or service that's not actually rendered. No claim should ever be submitted that represents a service, all or part of which was simply not performed. This is called billing fraud, people. I'm actually not accusing any of you. I'm just the presenter, okay? All right, number 2, providing and billing for medically unnecessary services. No employee will ever bill, should ever bill for medically unnecessary services or knowingly seek reimbursement for a service that is not warranted by the patient's current and documented medical condition. When a claim is submitted, the billing clerk is in essence certifying that the services provided and billed were medically necessary for the health of the patient, and that's in accordance with the orders prescribed by the physician. Duplicate billing. Employees should never submit known duplicate billing to any federal, state, or private agency. And duplicate billing occurs when an employee submits more than one claim for the same service, or the bill is submitted to more than one primary payer at the same time. And sometimes it can occur due to simple error. Knowingly duplicating billing, which is sometimes evidenced by systematic or repeated double billing, can create a liability, though. And that's under criminal, civil, or administrative law, particularly if overpayment isn't refunded promptly. So just keep that in mind. Upcoding. No employee should ever use a billing code that provides a higher payment rate than the billing code that actually reflects the service furnished to the patient. Upcoding is illegal. Don't do it. Unbundling is the last. Employees should never submit bills piecemeal or in fragmented fashion to maximize reimbursement for various tests or procedures that are required to be billed together.